Hello and welcome back to the How I Rehab podcast. My name is Nick Kane. It's a pleasure to have you on listening. We're excited about trying to continue to bring interesting guests onto this podcast to both challenge and stimulate different thought and processes around how you're doing things and how you can improve clinical practice. So today's guest, I think, hopefully achieves that. Bryan Heiderscheit. He's very well known in the space of running and biomechanics and hamstring injuries. So Bryan is a physical therapist by trade with a doctorate in biomechanics. His research is aimed at understanding and enhancing the clinical management of orthopaedic conditions with a particular focus on running-related injuries. He's director of both the UW Badger Athletic Performance and the founder of the UW Health Runners Clinic, and he's co-director of the UW Neuromuscular Biomechanics Lab. Bryan's been prolific in research over the years in bringing some fantastic research in both the running mechanics and hamstring space. The podcast today is obviously more trying to chat around, running mechanics and its relation to injury. It was a shorter podcast due to some limited time on Bryan's end, but some really good, clear takeaways, hopefully to help those working in the running space with both distance runners and sort of track and or field athletes. Now, we are fresh off completing the hamstring event that we ran in Italy, which was a fantastic success in the sense of the level of content was tremendous from our presenters. We also managed to film some really exciting masterclasses in that same trip with the likes of Carlos Pedre from Spain around soft tissue injuries and imaging, to JB Marin around the influence of acceleration demands on injury, Dermot Simpson on the assessment of hamstring injuries. Dermot works at Aspetas Senior Sports Physio there. And Chris Brahma, when we're talking to run mechanics, and it ties in with, today's podcast, obviously the developer of SMAS, the sprint assessment score, and really insightful piece from Chris Brahma. He's a Jet. So that was a great masterclass to shoot. So we've got plenty of amazing content coming your way on that platform. And event-wise, our next up event, we are in Boston, which does feature today's guest in Bryan Heiderscheit talking to running injuries at Fast Track the Injured Runner alongside Rich Willey, Colin Griffin, a number of other presenters there. Places are filling fast. It's only less than 50 spots left. And it's at the track facility by New Balance, which is a tremendous facility. So very excited to be over there for that. And our recently announced knee event, From the Acute to Capacity. We'll be covering off on all manner of acute knee injuries and really trying to optimize your management from bracing protocols to when is surgery and what sort of elements can we do really early in that rehab space to then taking us all the way through to, restoring that capacity and performance and navigating any pitfalls along the way. The likes of Sophia Nimbus to Luke Heath from Aspetar, Tim Sayers, who's done PhD around ACL, to Julian Feller, Tim Whitehead, some excellent orthopaedic surgeons. So we'll be covering off on elements from there to the non-surgical ACL to prevention and management around what we can do in the chondral space. So exciting, that event's filling fast. Stay tuned for further events to be announced coming soon around the world, including the UK. So that's an update here from the Sports Map. Let's get into this podcast with Bryan. All right, Bryan, welcome to the How I Rehab podcast. Very good to have you on board.
Yeah, thanks, Nick. Thanks for the invitation. Looking forward to chatting.
Now, mate, those who haven't heard you talk before and introduce yourself, can you fill us in a little bit about you professionally? Interested to your path and journey a little bit into physiotherapy, and obviously now you're a professor and doing some great research out of Wisconsin. But yeah, a little bit about also what you're doing now.
Yeah, sure. No, I'm happy to give a little background on it. As your point, maybe start with where I'm at now, which is at the University of Wisconsin-Madison. A professor in orthopedics and vice chair for research, and then also the director of the Badger Athletic Performance research program that we offer. So that's really a partnership between my department in orthopedics and University of Wisconsin Athletics, where we handle a lot of the student athlete performance testing, injury risk mitigation programming, and such. But before that, and as part of it, also, I'm a physical therapist and continue to treat patients through our outpatient practice. I started a runner's clinic here at Wisconsin about 20 some odd years ago. That's still rolling here today as well. And then also manage a student athlete clinics with our Badger athletes, primarily around running-related injuries, which can include sprinting and muscle tendon injuries, but also anything around returning to running after surgery, any sort of gait retraining needs that they might have. So the path to get here is, I mentioned I'm a physical therapist and have been for over 30 years. So that was really what caught me on this path, and recognizing that early on, I really like to answer the questions that we didn't have the answers to. Not that I have answered any questions over the last many, many years, but certainly I've at least tried to do that.
Yeah, beautiful. And I first came across your work like years ago in the hamstring space, but you're saying, there's been some fantastic research and work coming out of Wisconsin. And I know you also do, some really great athlete consultations there and really comprehensive. Obviously, I've had some experience there with some hamstring stuff with an athlete I've worked with before, but also, lots of obviously the NFL players and athletes coming through there. It's a great setup, and I'm sure it's an exciting place to work. So you've got so much developments happening. Speaking of developments, and obviously today we're going to talk through, the biomechanics space that you mentioned, and maybe its relationship with injury risk. We are heading to Boston for Fast Track the Injured Runner, which is a sports map conference mid-October. I'm super excited. It's got obviously yourself, Rich Willie, Colin Griffin on Achilles tendon, Rebecca McConville, and Ginger Gotteschool, along with Dan Coben, who works with you as well. Mate, what can we expect from that event from you, I guess? We've got some practical workshop, and what are we sort of going to break down, and what can we expect to learn?
Yeah, no, I'm really excited for this event. Like you said, it's a unique location with a unique group of speakers, all experts in their relative fields relative to running-related medicine. And then, of course, partnering with you and what SportsMap can bring to the table is fantastic, and we're excited to really start to see where this can evolve into. We've done a number of running courses over the years. Myself, Rich Willie has a bit as well, and it's always been one where we'd love to be able to do something unique and novel that brings in experts from a variety of areas, not just the physical therapy perspective, not just the strength and conditioning perspective, but really try to bring in that multidisciplinary approach to managing running injuries, which is exactly what all of us try to struggle with, which is how do we get that expertise in a variety of areas, including nutrition, bone health, bone stress injuries, muscle tendon injuries, tendinopathies, all for athletes who generally don't rest, right? They're very little off season for most runners. And many times they are used to having to train and perform while injured. And so it's less about how do we get them injury free, but how do we get them at a point where they can compete while still having some of these niggles, if you will, or other injuries that may be less than optimal.
Yeah, lovely. Well said. They're funny, avid runners, even working with them, it's, you'd say deload, and then they'll end up just running 100K weeks, and the balance between working through that, the psychology and all those pieces, pulling that together. And yeah, looking forward to it. It's going to be fun and interactive. And obviously we've got Dan on board as a presenter who works with you. Keep getting my light coming off here. I guess, keen before we talk to biomechanics of running, what are just a couple of things you guys are working at there that sort of we can expect to see in the coming period of time?
Yeah, so Dan Colbian, as I mentioned, he's a colleague of mine, as you mentioned. I've worked with him for quite a while. In fact, a funny story, he was actually an undergraduate student of mine long ago, and then we kind of got him hooked on what we were doing in terms of movement mechanics, sports-related injuries, and he had a natural knack for it, of course, and went on to do his PhD in ACL quad recovery, movement recovery after ACL reconstruction, and has now just done a really great job in expanding our knowledge in that space. So, our work has really focused on high-level athletes. In this case, University of Wisconsin Division I elite-level athletes, many who go on to play professionally in their various sports. No surprise, we have ACL injuries, right? As does every university and college setting or sports team. And so, because of the uniqueness of how we are set up within athletics, we're able to get longitudinal data on these individuals, including before they ever sustained their injury, tore their ACL. So we have really good data to be able to map out what sort of expectations of timeline should you see in both in terms of quad strength, quad rate of torque development, quad steadiness, activation steadiness. But then also, how does all of that relate to movement mechanics, to running, right? What sort of strength do you need, or should you have, in order to minimize your between limb asymmetry in knee extensor torque, for example, or in negative work when you're running, to make sure that knee is bending adequately, absorbing the energy that it needs to absorb. And how do we tie that in together from the muscle level to the whole body movement level? And again, that's really be the crux of his talk. And then we'll tie in things like, what happens when athletes are a year or two out and they're still not moving well? They still have a 15-degree deficit in knee flexion during running. Are there strategies you can utilize to correct their gait and actually to normalize it to the point where they're using the strength that they have? That it's not a strength loss issue. It's a decision. It's almost as if they've decided not to take advantage of the strength that they have. Right? They've developed what we might think of as a learned disuse pattern, and how do we regain normal pattern movement?
Yeah, beautiful. I've read a little bit around the steadiness aspect, and it's exciting, some of the research there. You're also involved in quite a big project around hamstrings. Can you just give us a little bit of an overview of that? I think, is it the NFL project or in line with, I know Dave Opar's involved?
Yeah, exactly. As you mentioned, Dave Opar and myself, and then Sylvia Blemker, who many of your listeners may have heard some of their work from Springbok Analytics and some of the MRI technologies that we're incorporating into it. So your point is exactly on. We've received funding from the NFL, and we've been tracking 5 Power 5 university football programs for the past several years. In fact, we just ended data collection this past May. So we're now in full data analysis mode. But yeah, we've got 3 solid years of biomechanics and imaging data and strength data on these individuals before they ever sustain their hamstring injury, and then following the injury and who goes on to re-injure. So it's a pretty massive data set of over about 750 unique athletes, almost 1,200 player years of data with well over 125 hamstring injuries sustained during that time period.
Yeah, that's cool. It's going to be exciting to see. I've seen glimpses. So
Yeah.
that's great work. We're excited around that. So let's jump and try to tease out some aspects around, I guess, our key topic in running biomechanics and the injury risk relationship. And I guess for me, in an evolution of just being a PT or a physiotherapist, early days it was sort of biomechanics was a little bit sort of poo-pooed in the sense that it's just come from where, as maybe a lot around, really finesse aspects around biomechanics, subtalar motion, etc. And it was really hard to look at what we call it running biomechanics with in the lab and motion sensor and all this sort of things. And things have changed a bit. I guess to sort of start with, what do we mean by running biomechanics? What is that?
Yeah, well, that is the $1 million question for sure, because I think depending on how you approach biomechanics, you can either love it or absolutely hate it. In my case, I've tended to love it. Yeah, it's been part of my research career for quite a while. And you're right. It's, if you start to really dive down into like subtalar position, the concept of subtalar neutral and forefoot, rear foot varus and whatnot, we don't pay any attention to that, honestly. I mean, it's part of what we measure for sure, but it's not the focus of it, nor is it anything that we put any emphasis on in terms of trying to modify or potentially modify. So really, when I approach and think of running biomechanics and the concept of changing running biomechanics, I try to think of it as a whole body approach to the task, to the movement. How do we maintain movement efficiency and movement economy, yet still being able to perform well, right? So in the case of, for example, running, you can argue that there are certain biomechanics of movement that make no sense if you're a distance runner, which is a sport that's completely based around how do I burn less energy so I can sustain a particular pace for as long as I need to, right? So movement efficiency becomes really important. yet you see invariably many runners who bounce a lot, right? Bounce up and down. So that's a very basic, simple biomechanics approach, right? How much does their center of mass move vertically? But of course, there's a lot of elements of torque and energy generation and absorption that go into that bounce. And so oftentimes the more somebody bounces when they run, the more mechanical load there is to their system, both in terms of energy absorption after landing and energy propulsion at takeoff, right? And so if there was a performance advantage to that, you could argue that that's a normal thing and a good thing for the sport. But yet we know that oxygen cost goes up as bounce goes up, right? And it also goes up if bounce is too little. So there's kind of a sweet spot, right, that we think of in terms of that. And that's probably a good example of a big picture sort of movement that we're thinking of. Another term that comes to light with distance running is overstriding, right? How far do you land out ahead of your center of mass? Because of course, the farther out you land, the more you're decelerating every stride, and then you have to accelerate again. So there's a movement efficiency aspect to it, but there's also a mechanical load to tissue aspect of it that we need to pay attention to from an injury standpoint. So when I think of running biomechanics and potentially modifying those, which we do, I center it around the idea of, are they moving as efficiently as they need to move or could move relative to their goals as a runner and relative to any injury history they may or may not have.
Okay, so you're sort of really basing it on the individual and tying it together. I guess for me as a clinician working, what do you recommend I utilize to sort of both improve my ability to analyze? And I mentioned, there was fourth place and motion capture. Now, I guess in real time in clinical land, what are some avenues that you would recommend?
I still recommend for the average clinician who's looking to invest no money and to get something done, you do need to watch the person run, for sure. Unfortunately, watching them with your eyes doesn't work, right? You can't see enough and you can't really get enough of a sense of normalcy. You can see some characteristics for sure, but ultimately just using a slow motion video, a simple 2D video, use your iPhone or your camera on your phone to be able to take a quick recording from a sagittal view and potentially from a frontal view. That's a great first step, right? And we've had a few publications on how we recommend breaking that down, what's the standardization that goes into it. But talk about a no-cost, simple, easy to integrate into your normal clinic workflow that doesn't disrupt your practice, really, or require you to invest money up front to wonder if it's going to succeed. So whenever I do a course that I offer on how do you set up a runner's clinic and how do you get it going, I'm always the first to say, start with as low tech as possible. Get your feet wet, get understanding of what the interpretation of the information is, and then decide if and how you might want to upscale some of your tech. But simple 2D analysis can work wonders to get started.
Yeah, beautiful. What does the evidence say when it comes to what we really should be analysing? And maybe we need to break that down into two-part question, potentially being a faster soft tissue type of risk, let's call it a hamstring, and then the endurance runner type of thing. What are probably the main ones that you found? I know you've been involved in some really important research in this space.
Yeah, no, good question. And it's something that I've always kind of pushed back against when people talk about what are the risk factors for a running injury. Well, what's your running injury, right? I mean, that's like saying, what's your risk factor for a football injury? Is it a concussion? Is it a soft tissue injury? Is that an ankle sprain? There obviously are going to be different factors that are at play. So I think when you're talking about distance runners, the one injury that gets a lot of attention, rightfully so, are bone stress injuries, right? So trying to decide what is a risk factor or an important element surrounding bone stress injuries is critical. And so we've had a couple of papers of late that have used our clinical prediction models to look at running mechanics and DEXA scan data, like bone density type of measures, lean mass measures, to be able to say who's at risk for certain bone stress injuries based upon their presentation before the injury ever happened, right? And in high mileage runners or in competitive runners. And no surprise, two of the points that I mentioned earlier, center of mass displacement and turnover, your step rate. Those are two of the strongest predictors of who goes on to sustain a bone stress injury, irrespective of mileage and irrespective of injury history. Now we take the other piece and it's like switch gears, so maybe something more soft tissue. Again, now you have tendinopathy type injuries, and that certainly is a big deal for distance runners and other similar sports. And there might be another subset of risk factors for those. Switch gears to more muscle strain injuries. They're still thinking more of a speed type of movement, whether it's in a team sport setting or it's in sprinters themselves. Hamstring strain injuries, the number one predictor is a prior hamstring strain injury, which we all know very well. And so then it starts breaking down into, well, why is that? Are there residual deficits that exist from that prior injury, such as a smaller muscle volume, which seems to persist quite lengthy, inappropriate activation of that muscle in certain circumstances, changes in the muscle morphology or shape, including the architecture. Some of Dave Opar's work with fascicle lengths, for example, and Ryan Timmons' work in that space as well. But then you even get into other areas such as movement mechanics. How do they sprint? What's their pelvic tilt position? Do they overstride? So a lot of pieces can start to come together. We would love to be able to say that if you measure this one thing, you can predict injury risk in this one space. And we know that's not the case. Nothing is as simple as measure one thing and you can identify 75% of the injury risk.
Yeah, okay. And I guess where do you fit? Like, I'm sure it's an obvious answer, and we've got the approach to building strength, building capacity, and I guess, do you feel if that's still really important in, whether it's bone stress around their region or a muscle injury to really build that capacity, and then the influence of the biomechanics comes into that? You're probably not just like one or the other. Is that fair to say?
Yeah, that's exactly right. In fact, you probably took a peek at one of my slides in my slide deck, one of the talks that I give. It's exactly right. It's like this balance, right, between capacity and demands of the task, and ultimately which one deserves more attention. And I don't think any one does deserve more attention until you know who you're trying to apply it to. And based on that N of one in front of you and what you're seeing, you can start to deduce, it's likely that their capacity is the rate limiter in their case. And so the task demands might not need much modification, if any, or needs to be modified only temporarily as part of their overall conditioning work, right? But then in other cases of individuals, like, for example, a perfect group are like our novice runners, right? Those who are new to distance running, picked it up maybe in their mid-30s, haven't really done much distance running before. They're trying to figure it out. They're really learning a whole lot, not just about how to run efficiently, but what their body, what sort of prior activity level has their body experienced. And they're learning things like what's footwear, what sort of clothing, what heat regulation, all these sorts of things. That's a group that can benefit a lot from the demands of the task, right? Because that would naturally happen with experience and time. So we can help expedite that in a lot of individuals to give them the fast track, no pun intended relative to our upcoming Boston event, but to give them the fast track toward moving more efficiently.
Yeah, lovely. Love the pun. Yeah, okay. So I might use that reference around, I guess, I think you use like a recreational runner as a term versus maybe a bit more of a high level runner, pro, semi-pro, in the sense of like, most of our listeners are often probably in the PT space, athletic trainer space, and physio. And our bias or go-to and fallback is often that capacity building space because that's where we sit a bit more comfortable. And I'm I'd be in that. And you're a physical therapist by trade, so you can know where we're coming from. How do we go about retraining that? And I guess the key thing there is obviously in the two-part recreational runner, you might say, well, we can retrain it a fair bit because they're missing some really key chunks of pieces of the pie. But maybe that more pro runner, and I'm talking endurance space here, that maybe had some recurrent bone stress over the period of time. You're trying to work on their diet and their capacity, but there's something within their running gait
Yep.
that you think is a really key influence here. But they've been running like this for years, and they're a pro, and it's probably a bit more difficult. So how do I go about navigating those two sort of scenarios?
Yeah, no, that's a great question, and it's something that we do face here at Wisconsin. I mean, our men's and women's distance running programs are very strong. Wisconsin men's team is out of the past 30 Big Ten conference championships rather, they've won 29, right? So they are a very strong powerhouse group, and have produced several national champions and several professional runners who come out of it. Many of whom, by the way, who've run for the Badgers are from Australia. So we have a nice pipeline coming in from your turf. So it's been great to work with them because, again, as I mentioned, we collect this running mechanics data on every one of our cross country runners, for example, amongst other sports. But when they first arrive at campus, and every single year we measure it again, and we look for changes in their technique, natural evolution that may happen relative to their training distance and their speed. But we also want to put in the context of exactly what you mentioned, which is their injury history. If it's someone who's never been injured before, we tend not to do anything about it. Even if we see inefficiencies in their gait, it's like, you know what? It's working for them, and they don't seem to have any negative effects from it. So let's just let it go. But for someone who's had repeat bone stress injuries, chronic Achilles issues, for example, and you've got the capacity side of it dialed in, right? That, like you said, that's a critical piece to it. We will also then bring in, all right, what if we tweaked your gait? What if we just adjusted that a little bit, as minimum as possible? I'm not a fan of overhauling somebody's running style. It doesn't make any common sense, really, because that's such a big sweep to what they're doing that not only are you going to make them extremely inefficient in the short term, but you also run the risk of a whole lot of load redistribution and exposing other tissues to risk. Yeah. So we try to make the smallest adjustment possible and always put it back to the context of the athlete of, is this comfortable? Does it just not feel right? And it likely is going to feel a little bit goofy or awkward initially, and then gradually as they get more exposed to it, becomes a little more seamless. And you're on the right track when the athlete says, running actually feels easier now than it did before compared to when I used to run before. And again, these are top level athletes. These are scholarship athletes. These are athletes who are getting paid at the collegiate level to participate in various events and have a chance to go professional. Yet they can still benefit from some targeted suggestions at times.
I'm going to try to, and I'm jumping between, I guess, the soft tissue speed and endurance, just sort of breaking that up. Sitting on the endurance space, let's say, can you give us an example that maybe someone that you've worked with, an endurance athlete there, let's call it repeated tibial bone stress over a period of time or something in the foot, and maybe they are getting that sort of bounce, the center mass translation up and down. What's a small cue, a small adjustment that you would do, just that little small aspect where you'd sort of start with?
So usually the reason I said before that center of mass or bounce and step rate are two strong predictors. Well, those are highly correlated measures, right? Usually the lower somebody's step rate is, the greater their bounce will be. So you can use step rate as like a metronome to drive some of that change in bounce. Yep. Or you can even use a mirror feedback, something as simple as that. So the technique you use is so dependent on the person. That's actually the hardest part of gait retraining. It's not figuring out what you want to change. It's figuring out what's the right cue the person's going to respond to. And they're going to be able to understand how to implement it.
Yep. All right, nice. And I guess in a hamstring space, sticking with that on our speed or track athlete, obviously that sort of terminal swing or, overstride is probably at one factor. And, we've got some content from the likes of Jonas Dodo and some muscle retraining on our masterclass platform. But how do we go about sort of just, that could be I'm a really fast athlete, and you're seeing that 5-10 degrees on one side. How do I go about trying to rebalance that and retrain that in the sprint cycle?
Yeah, we just tell them to run slower, and it takes care of it. Yeah, obviously that's not. I'd be quickly out of a job, right? So obviously that's not the answer at all. But those are tricky. Getting gait retraining to happen at that level of speed is way different than for a distance runner. And so this is one that I would admittedly, I think I struggle with to be able to implement this effectively and for them to be able to put it into the context of competition. So it's one thing if you've got a 100-meter sprinter, right, and they can really focus on their mechanics. I think it's a different element when you're talking about an American football player who's at top speed sprinting on a kickoff return and now has people coming at them, or you've got a receiver running a route, or a soccer player or an Australian football player, the same sort of position where you've got this chaotic environment, and having them think about their movement mechanics just is not an option in those circumstances. So I think there may be some elements that eventually would carry over to the point where it doesn't require an active thought process. But I think that's a challenge for sure. That's a challenge for sure. And there are others out there that are doing more of that work, and I'm excited to keep up on what they're doing.
Yeah, nice. So now we're going to start to look to wrap things up because we've got, you're a busy man. You've got commitments straight after this. I guess we're probably talking around the running mechanics and the injury risk, and it's clearly, there's evidence and research more and more coming out to say it's certainly a piece of the puzzle and something that we need to, as clinicians, maybe not be absolute experts at, but we need to be upskilling and improving our ability to analyse and implement some strategies. What is coming forward in this space for us to sort of, where does the research need to go a little bit more, or what avenues are sort of, where are we missing at the moment? And is there anything we haven't really covered off on here?
No, I like that. I think, to me, I see the two big areas. One, we do a really good job of measuring biomechanics inside in a lab setting, right? Or in a more controlled environment. That's good. That's useful. But in the end, we want to be able to measure their mechanics and movement outside, right? In a more typical environment when you are able to account for grade, temperature changes, whatever elements may be at play. That needs to be better, because right now a lot of that is just based on, for example, Strava type data, which is very useful. It's incredible data to collect, but you're not really getting anything at the individual's biomechanics or movement and what role does fatigue play, for example, into how they run. So that's a big area that I would love to see advance more. The second one is better information on the individual, right? To do a better job of quantifying some of the elements of their structure. So we know tendons are critical for runners and any athlete, and yet many times they start to show some tendinosis well before symptoms develop, or changes in tendon quality, mechanical properties like stiffness, for example. Getting better data for those, whether it's through imaging, ultrasound-based type of work that can play a role in not only B mode type of imaging, but like even getting to shear wave, or bringing in, MRI sequences of muscle volumes. I think, it's sure right now it seems like a pie in the sky where I'm going to take an MRI on my patient for the purposes of baselining them. But boy, these sequences are getting faster and faster, right? We're down to 8 minutes now for an entire T12 down to your heels, and getting all the muscle tendon morphology data out of that individual. Incredible data set. So maybe not for your recreational athlete, but I think for your more elite, higher end individual, I think that could be extremely valuable.
Yeah, okay. So some really good tools, hopefully, for obviously those working with elite pro athletes, and then for us or other our listeners working with the recreational runners, it's probably around feeding off that information and then hopefully being able to apply it in real time and at probably less expense. So hopefully there's some information within this podcast that gives both of those listeners some avenues, and clearly we'll cover off on more detail to help both regions of athlete and professionals at our future conference. And mate, looking forward to chatting looking forward to hearing your work at Fast Track. Thanks for jumping on, and really appreciate your insights.
Absolutely. Thanks, Nick. Appreciate it. Look forward to seeing you in Boston.